Now the next thing that we will be studying is about the immunodeficiency disorders. So what happens in the immunodeficiency disorders? In the immunodeficiency disorders, there are conditions in which the immune system is either absent, deficient or defective. Overall, what they want to say is that the immune system is of no use. They are not able to fight the infections. And if the body is more susceptible to the infection, then also they are not able to fight that infections, and as a result of which your body became more prone to any kind of infection and any kind of malignancies, right? You have the classification, you have the primary type and the secondary type. In the primary type, you have the SCID, that is your severe combined immunodeficiency. You have the Bruton's disease, you have the selective IgA deficiency, and you have the DGOT syndrome. We'll study about them in details. In the secondary, you have the HIV or AIDS, very popular. And tell me, when is the World's AIDS Day celebrated? I guess it's 1st December, right? So you need to remember this information also. It's very, very good to remember this kind of information. Then you have the malnutrition, then you have the chemotherapy and the chronic disease. Now, let's see about the pathogenesis. What happens is there is defect in the innate or the adaptive immunity, as a result of which there is failure in one or more of the components. Let's see what are the components that are there. First one is there is failure in the antibody production. Then T cell mediated immunity. There is defect. Next is in the complement system. Fourth one is in the phagocytic cell functions. Okay. Now, let's see about the primary immunodeficiency disorders in details. First one you have is the SCID, that is severe combined deficiency disorders. See, it is a defect in which both the T cells and the B lymphocytes are absent, or either they are dysfunctional, means they are of no use. See this very, very beautiful diagram. That is, here you are able to see a normal person, and in the normal person you have both the T cells and the B cells that are present. They can fight the infection. But if a person is having SCID, his or her immune system is of no use. So they don't have the B cells and the T cells, and as a result of which what will happen? They are more prone to having infections, right? The clinical features that we are able to see is severe recurrent infections, failure to thrive, and chronic diarrhea. Next, what are the investigations which you will do? In the investigations which we are able to see that the lymphocyte counts are low, there is immunoglobulin levels low, and genetic testing we will do. Next, the treatment that we will give is the bone marrow transplant, antibiotics, antifungals, and the supportive care which is required according to that person. Okay. Next you have is the Bruton's disease. And remember one thing. See, Bruton's, now always remember the letter B's. Okay. Because it is more common in boys. Boys, B cell maturation and the disease itself, Bruton's. Okay, BBB. Remember all the B's that are there. So what happens is there is a precursor. The precursor gets converted into the pro B cells, but now they are not able to convert into the pre B cells, and then it is not able to convert further into the mature B cells. Okay, so there is absence of immunoglobulin, and the clinical features that we are able to see, there is enteroviral infection, the recurrent pyogenic infection that is there in the Bruton's disease. Investigations that we will do, in the investigation we are able to see there is no mature B cells, there is low or absent IgG, Ig or IgM which is there. In the treatment you will give the regular IV immunoglobulin therapy and antibiotics you will give for the infection. Next, coming to the third one that you have is the common variable immunodeficiency. In the common variable immunodeficiency, what happens is it is basically a B cell dysfunction, and there is recurrent cytopulmonary infection associated with the autoimmune disease. In the diagnosis, we are able to see the low levels of IgG, Ig and IgM. In the treatment, we will give the immunoglobulin and the replacement therapy. Okay. Next you have is the DIGOT syndrome. And in the DIGOT syndrome, before starting with the clinical features, let me just write down something for you. All in the DIGOT syndrome, it is also known as the 22q11.2 deletion syndrome. Okay, deletion syndrome. Next, what happens is in the clinical features that you have the endocrinal disease, that is the hypoparathyroidism and the hypocalcemia. You have the heart defect, Pallard's tetralogy, pulmonary atresia, atrial trunk, and the septal defects. Okay. Then you have the anxiety, attention disorders, schizophrenia, intellectual disability, which are there. Next that you have is the ear helix are folded and the patellar anomalies which are there. Okay, and the coloboma is there in the eyes, right? So these are basically, see, not remember much, but remember what are the basic important things that are there in the Dicot syndrome. See the key features. If I talk the key features, if I talk here, first one can be your 𝗖𝗵 hypoplasia. 𝗖𝗵 hypoplasia. So what happens in hypoplasia? It is basically a T cell deficiency. Okay. Next one can be your hypocalcemia. Next one can be your hypocalcemia. Third one can be your congenital heart defect. Congenital heart defect. And the fourth one can be your developmental delay. Okay, fourth one can be your developmental delay. Okay, so these are basically the key features which you need to keep in mind. What are the investigations that we will do? The investigations that we will do here are the first one we will do is the FISH. FISH is basically technique. FISH is basically a technique that we will do. And in the management, what we will give in the management? We will give the calcium supplementation. We will give the calcium supplementation. And what else we will give? We will do the thymus transplantation. Thymus transplantation. So this was all about the primary syndromes that you have, right? We will talk about the secondary syndromes now. Before jumping onto the secondary, let's just solve some MCQs. The first question that I have for you is, let it be, what should be the first question that I gave you? Okay, we'll solve just one question. Okay, tell me, 22q11 deletion is seen in which disorder? So it is basically seen in the, I'm giving you the answer also, Dicot syndrome. This was all about the primary immunodeficiency. Okay.